Hi, my name is Walter Madalinski. I'm a clinical nurse specialist and electrical engineer here at Hospital Mission Tarahumara in Samachique, Mexico. And this is Savannah, my daughter, and our family's here serving the indigenous tribes as well as the locals of our region. My role includes providing critical care as well as surgical assistance and facility logistical planning and maintenance.
Hi, I'm Adriana Madalinski, and this is Samuel Madalinski, and we are in Mexico in the Sierra Tarahumara at Hospital Mission Tarahumara, and I'm a registered nurse.
Well, my wife and I met in 2012 serving as missionaries at a hospital in Guatemala, Hospital Shalom, and after a season there, the Lord called us back to Texas to get married and figure out what God had in store for us as a new married couple. God quickly revealed to us that I should go back to school and pursue an advanced practice license in nursing. That took about 4 years to complete, almost 5. And after that, we knew God was calling us back to the field right away, so we started looking at mission hospitals through Samaritan's Purse, and they partnered us with Hospital Mission Tarahumara here in Mexico, and we prayed about it. We came and visited, and it just seemed like where God wanted us. And so now we're here getting to serve the Tarahumara people and the people of this region.
No, honestly, it was exciting because we did missionary work as singles, and it was exciting to see the Lord just bring us both together. We both had a heart to serve. We saw that the Lord's heart in serving the needy. And so it was really exciting to get that direction from the Lord that He wanted us to continue doing this. A little bit nervous to do it as a family, but also exciting to be an example to our kids, and leaving our comforts and leaving family, being willing to step out into a unknown world and a new challenge. It was nerve-wracking, but also exciting. Exciting to be able to teach our children, this is the Lord's heart. Kind of teach it in action, and not just in words. So.
Well, after we set our sights on Hospital Mission Tarahumara, we really wanted to find a sending agency that would really help us and equip us and enable us to serve long-term. When we had served previously, we had gone independently without really supporters or any sort of supporting agencies. So we found Christian Health Service Corps through some friends of ours, and we've been with them ever since.
Yeah. Well, we're still learning. We've only been here about 10 or 11 months, but it's challenging. Like I said, it's exciting. I like the fact that even though Daddy gets pulled away to help, in the middle of dinner, in the middle of the night, or something like that, it's an opportunity to tell our kids, hey, Daddy's gonna go help sick kids or someone that's hurt, got a lot of owies, let's pray for them. And we've caught Samuel saying, Daddy's helping babies, right? Daddy's helping sick babies. And so it's great because it gives us that opportunity to just kind of minister to our children that way. I've heard it said that ministry is to he who's in front of you. And so right now, because I'm the one that's mainly with the kids, they're my main ministry, and I get to serve a little bit in the hospital, but being here gives us the opportunity to, show them what we're doing. I mean, we're just steps away from the hospital, and sometimes we'll go for walks and see the patients outside and wave at them or go approach them and say hi to them. They get to see the work that we're doing a little bit, firsthand in some ways. So that's great. It is challenging sometimes. There's not always a lot of children around, and the culture here, for some reason, the children don't like to associate much with, outsiders. And so it's passed down in the children too. I've noticed when the American children are playing at the park, the indigenous children, if they were there first, they step aside, and then they let the American kids kind of play and take over the park. It's very interesting. And so again, going back to that thought that ministries to he who's in front of you, I get the opportunity to kind of talk to the kids. They're broken Spanish. I don't speak Tarahumara. So, trying to say, hey, let's play together, trying to minister to them, help my kids be a tool, also a ministry tool, So it's a challenge, but it's also a blessing, yeah.
So my family and I have been here for almost a year next month, and one of the biggest blessings we've had is just getting to utilize all the experiences and the knowledge and the skill sets God has equipped us with to serve at the hospital here, and just to serve the people, and to get to build communities with the people here. It's just been really exciting to see how God has taken every experience we've been through, and all of it has prepared us to have an ability and an insight into what we're involved with now. So that's been really cool to just see God confirm just His faithfulness and in the hard things that He's taken us through, in the fruit that's bearing now.
I said, being here as a family and being able to, show our children, even though they're still little, just show them God's heart in serving, through our actions and our sacrifice daily to be here and serve. But I love being part of an amazing team. There's an amazing team of people here, and even though I can't be at the hospital as much as I'd like to, even being part of just even a small part of being able to help people that otherwise wouldn't receive help. They wouldn't get the help if this hospital wasn't here. Already we're remote, but there's people that live so much more remote than even where we are. So it's difficult for them to get to here. So there's people that are village missionaries, that take part in bringing the people here. And then there's people here that they do so many little and big things to help people physically and spiritually. And just being a part of that team, I think is just amazing to see the Lord at work in an amazing group of people. People just pouring their gifts and talents, pretty amazing gifts and talents for such a good cause. I think that's one of the biggest blessings.
The biggest challenges for me, with my engineering background and my nursing background, I can get involved in a lot of things, and I can get my time can disappear very quickly, and unfortunately that pulls time away from my wife and family. And so I guess advice for new missionaries would be definitely be prayerful about what you get involved with, because it's too easy to, especially if you're someone who's got a wide scope of abilities, to get pulled in all directions, and your time can disappear pretty quickly.
I guess as a family, it's hard to balance, wanting to help at the hospital and then wanting to be there for your family. That's a challenge. Just seeing the many needs that there are, both in the hospital and even in the community work. There's so many areas to get involved in, and kind of wanting to jump in and do so many things and be able to help in so many ways. That's challenging. when you have a young family. Yeah, I would say I guess that's the biggest challenge. Yeah.
Yeah. The advice I would give is really as husband and wife, really hash out how you're both going to be serving and have that clearly understood, because when both of you are very talented and has equipped both of you to do amazing things, those ambitions and those desires to serve, when you have to trade off with your family, trade off with kids, it can make you work the equivalent of a 60-hour week when you're trying to work full-time and then your spouse is trying to work part-time, and but you don't ever work at the same time, so it's your work schedule doesn't overlap, so it becomes time can be very valuable. So just have a clear understanding of how you're going to work together and minister together realistically.
I used to think as a young, like a single person, I thought, I better do missions when I'm single. I better do it now, because later with a family, it's just not going to be possible. I used to think that, and I feel like I took advantage of that as a single person, and then got married, and we're like, no, the Lord's still putting this on our heart. We got to do this. And I would say, yes, it's challenging, but follow the Lord's leading, because yeah, I wouldn't not do this, even considering the challenges. I think it's more of a blessing to our family than to not do it. So I would just say, follow the Lord's leading. It's not impossible. It's hard, it's challenging, but it's, even the little that you can give as a mom of young children, like I said, you're still part of this really amazing group of people, and it's a team. And it's the Lord's work. He will take the little seed that you pour, and we're just trusting He'll grow something beautiful out of it. So.
Yeah. So we put in 10 hours yesterday doing construction work on our new electrical overhaul project, and then about 11:30 last night got the phone call that we had a trauma patient with multiple stab wounds, and which we then took back to the OR about 1 o'clock in the morning and wrapped up about 6 a.m. And then we got at it at 8 o'clock this morning to push ahead with that construction project, since we have a big team coming in 3 days. So we got deadlines, and but you can't put off dying people, and you can't put off major projects with lots of supporter money and hundreds of man hours coming your way. You got to utilize it all and take advantage.